This is part 8 of the assessment and care of the newborn. In this lesson, we will discuss the nursing role in the care of the newborn and family. So the nursing role. Be knowledgeable about normal newborn variations and responses that indicate further investigation. Know what's normal and what's not, such as respiratory distress, central cyanosis, thermoregulation problems, dehydration, imperforated anus, failure to pass meconium, failure to void, evidence of neural tube defects, and or evidence of need for genetic referral. So let's talk a little bit about parent teaching. During the physical and behavioral assessment, you will identify the family's need for teaching. You want to involve the family early into the care of the infant. So teaching can include, but is not limited to, feeding cues, the alert state, the cord care, safe sleeping, how to check the baby's temperature, and when to call a pediatrician. You want to be able to help parents to recognize newborn states, sleeping or alert, signs of stress, help baby, sleep well, help baby eat well, considering what to do and playing with the baby to help them learn and grow. So kind of review the family-centered care, page 622 of your textbook. Home care and infant safety, page 623, and then home care starting on page 628, and then the family-centered care on page 630, and patient teaching signs of illness, page 630 of your textbook. So the goals of nursing care are to promote physical well-being of the newborn and to support the establishment of a well-functioning family unit. So let's talk a little bit about some possible admission nursing diagnosis. There's a potential for ineffective airway clearance related to presence of mucus and retained lung fluid. There's a risk for imbalanced body temperature related to evaporate and radiant and conductive and convective heat loss. There's a risk for infection related to immature immunologic defenses and environmental exposure. So if you look at page 604 and 614, they provide the drug guide for newborn medications. So when looking at the newborn hospitalization, the admission of the baby will be admitted to the newborn nursery or nursery mother baby unit. You want to monitor the baby's condition 48 to 72 hours. They may have a hearing screen. You want to prepare for discharge or anticipate the discharge needs. They may need a Hep B vaccination. There's going to be a newborn screening, a belly check. You're going to have signing of the discharge papers, and then you get to send the baby home. I want to talk to you a little bit about the PKU. That checks for cystic fibrosis, galactosemia, congenital adrenal hyperplasia, hypothyroidism, maple syrup disease, phenylketonuria, sickle cell, and you can do an expanded screen to check for other things. Okay, so we're going to look at daily care nursing diagnosis. There's risk for ineffective breathing pattern related to periodic breathing. Imbalanced nutrition, less than body requirements related to limited nutrition and fluid intake, and increased caloric expenditure. Impaired urinary elimination related to meatal edema secondary to circumcision. Risk for infection related to umbilical cord healing, circumcision site, immature immune system, or birth trauma. Readiness for enhanced behaviors related to lack of information about basic baby care, circumcision, and or breastfeeding. Readiness for enhanced family process related to integration of newborn into family or demands of the newborn care and feeding. Risk for injury related to hyperbilirubinemia. Risk for injury related to sole dependence on caregiver. And then we also can have readiness for enhanced family coping related to anticipatory guidance regarding responses to the neonate's crying. So when admitting a baby, we will get report from labor and delivery. Then the baby and the mom arrive to the floor. We will begin an assessment. We will watch for signs of distress. When the baby is stable, we will provide a bath. You will monitor blood sugar if it is applicable. And you will also make sure the baby is being fed. Okay, so you need to know the baby's info, the APGARs, the meconium, how the transition has been going so far, delivery details, labor details. When did the water break? How long was it ruptured before delivery? Was there use of forceps or vacuum? Medications mom received before delivery or during delivery. Any problems with the pregnancy? How is the bonding going? You want to assess airway, vitals, head to toe assessment, birth measurements. You want to keep the baby warm. You want to put your chart together. Verify that the eye ointment was given and vitamin K shot given. You also want to remember it's dependent on where you work that some places have an actual birthing area where they will birth the baby in the same room as that they stay in for their hospital stay. Some hospitals you have separate floors where they have the labor and delivery, and then they transfer the mother and the newborn to another unit. So depending on this information, it'll depend on where you're working, whether you will actually will get report from a labor and delivery nurse, or you'll be the one that's taking care of the baby from the time the baby was born all the way up to discharge. So routine care will include vitals, the assessment, and you want to do it every 6 to 8 hours. You want to teach parents how to put the baby on their back to sleep, how to use the bulb syringe, teach them about cord care, how to diaper the baby, how to swaddle the baby, hospital safety and security procedures, how to feed the baby, infection prevention, how to bathe the baby, when to call the pediatricians. And you want to make sure that you ask the parents about the baby's names. Do they smoke? Do they plan on circumcision if it's a male? Do they have a car seat? Do they need education about the installation of the car seat? You want to get family history of milk intolerance. Monitor your parent and baby interaction throughout the hospital stay and report any odd behavior. Odd behavior such as parents who are detached from the baby. They don't want to feed or change the diaper, or they send the baby into the nursery all the time. Or parents who are never in their room, especially if there's a social history. Okay, let's talk a little bit about circumcision care. There's three methods. There's the Gumco, the Plastibell, the Sheldon clamp. You want to verify the consent is signed, prep the baby, pull medications for the physician. You may have to give Tylenol. You're going to assist as needed, and you're going to teach parents about post-circumcision care. You want to definitely do no circumcision if the baby has a hypo or epispadias, and they may need that foreskin for repair. With the Plastibell, there's nothing special for care afterwards. Plastibells fall off after about 8 days. With the Sheldon and Gomco, you need to apply Neosporin or Vaseline for the first week until it heals to protect it. For non-circumcised babies, there's no special care that's needed. Don't worry about retracting the foreskin. Just keep it clean with soapy water from the bath. You can make sure they understand about car seat safety. Make sure that they know that the baby is to ride in a rear-facing car seat in the back seat. If services are available, teach them how to correctly place the baby in the car seat and how to install seat in the car, and never leave the baby alone in the car. Talk a little bit about the shaken baby syndrome. Warn parents about the danger of the shaken baby syndrome. Encourage them to make a plan, offer ways that usually calm the babies. If all else fails, put the baby in the crib and walk away and call for help. You will also teach them about voiding and stooling. Babies should void within 24 hours of birth. By discharge, they should have at least 6 to 8 wet diapers a day. Their first stool should be within 48 hours of birth. By discharge, the baby should have at least 3 to 4 stools per day, and then you want to tell them about the transition of the stool process. So more discharge teaching can include how to teach parents how to check a baby's temperature, how to wake a sleepy baby, again, how to use the bulb syringe, how they should lay on their back to sleep, how much to feed and how often to feed. Teach them to never give babies honey under their first year of age. Teach them how to bathe, how often they should bathe the baby. Wait until the cord falls off for any actual tub baths, and when the baby should have tummy time. Okay, we're going to kind of go over a little bit of baby-friendly requirements for hospitals. This is just a brief summary, and every hospital may be different. So, babies room in with their moms. There are no separation. Um, there are no formulas provided unless medically necessary. There are no bottles or no pacifiers provided. You want to encourage breastfeeding on demand. You want to teach moms how to pump, get them the support that they need. You want to train staff to assist with breastfeeding. Have a breastfeeding policy that staff will uphold, and then educate the moms on the benefits of breastfeeding. This concludes the lesson of assessment and care of the newborn. If you have any questions related to these lessons, contact the instructor.